My name is Andrew Kelly. I'm an Anaesthetic SHO at University Hospital Galway. This is a re-audit of the Anaesthetic emergency folder at a tertiary surgical centre. The authors of this audit can be seen on the slide in front. The introduction to this: each operating theatre at University Hospital Galway should have an anaesthetic emergency folder as per hospital guidelines. This outlines management and cognitive aids for the dealing of many of the common anaesthetic emergencies. The evidence for this is highly suggestive that cognitive aids and algorithms help to reduce morbidity and mortality in emergency situations. There was a previous audit performed on the availability and completeness of these anaesthetic folders in 2023, showing that 44% of OTs had no anaesthetic emergency folders. At the time, all of the folders were reinstated and the theatres were restocked. The methods used to perform this audit was to review all 16 theatres at UHG, and the standard we used was a bound book with no missing pages and correctly indexed as per with contents included. The results showed that 37.5% of theatres had no folder. Another 37.5% had an old edition of the folder, and there was only 18.7% of theatres that had a complete and correctly indexed folder. And we also found that there were multiple outdated guidelines, particularly around local anaesthetic toxicity. The conclusions based on our results would suggest that the provision of the emergency anaesthetic folder is suboptimal. There has been a slight improvement in the folder presence since the 2023 audit, but however, the number of incomplete folders has actually increased in this time, and there's been an increase in the number of outdated and withdrawn guidelines in the folders that are present. So our next steps will be to replace the missing folders and develop a more succinct and durable folder system, and to regularly re-review and re-audit this standard.